Betty Gallo and a little bit of her vision for women against prostate cancer.
Good afternoon. I'm actually going to give you a little overview of what the Gallo Center is about, because I don't think everybody understands completely who I am and why I am doing what I'm doing. My husband was a congressman for the 11th District of New Jersey, and he was diagnosed with prostate cancer in 1992. His PSA level was 883. It was already into his bones, and they gave him about 3 to 6 months to live. Fortunately, the Cancer Institute of New Jersey, where I am now working, was not available, so we went to NIH because he was in Washington 4 out of 5 days. And he fortunately started the protocol Serumin along with combined hormonal therapy. And because of that, his PSA dropped to 3.5 the following March, and he survived 2.5 years. It was probably the best 2.5 years of my life with him, because it really drew us closer together. It was a big roller coaster, but in a lot of respects, God had a lot to do with that, because if it weren't for him, I don't think we would have gotten through this whole process for those 2.5 years. What happened after that was I became an advocate in 1995, because some voice came to me and said I had to do something for prostate cancer. I'll kill that voice when I get up there. But anyway, what had happened was I started with the ACS, and they really didn't do much on prostate, so we started a memorial tournament in memory of my husband. And from that point on, I started working with the American Foundation of Urologic Disease. I started working on a state level, and then I eventually started doing some programs at a national level. So in 1997, one of the things my husband wanted to do was get out and do screenings and education of prostate cancer. So they had created the Cancer Institute in New Jersey in 1994, and my husband helped get the first $10 million for that, which I didn't know till after he died. There's a lot of things I didn't know till after he died, but very good things. But anyway, I go on to the director, Dr. Bill Hite, and said I wanted to create this center. And we decided to call the Dean and Betty Gallo Prostate Cancer Center. And of course, they didn't know how I was going to accomplish this. So I brought the New Jersey delegation down to see the Cancer Institute, which they had not seen yet. And they were very impressed. And Rodney Frelinghuysen, who took my husband's place in Congress, was on appropriations and watched what I did. And when he saw that I had a passion for what I was doing, he decided to step up to the plate, and in 1999 we got our first $1 million. Since that time, up until last year, we'd gotten $16.2 million, and we got another 2.4 this year. What this has done is the center, which is now part of the Cancer Institute, we have our own administrative offices, we have clinical trials, we have our own laboratories, we have our own clinic to see patients. We're a multidisciplinary center. When you come, you see the urologist, the oncologist, the radiation oncologist, and whomever else they need to see. So it's like a one-stop shopping for people. Through that, I've become Director of Public Outreach and Government Relations, and I take care of the outreach component. We do have a program that we're starting now. Out of some of the money I receive from Congress, we're taking $100,000 and starting to do a grassroots program with the public health officers in one of our counties to really start educating the public on prostate cancer, because again, you know, we talk about the doctors, but the doctors don't have the time to sit down and really talk to their patients. I've had people tell me where they've gotten phone calls over the phone. Well, you have prostate cancer. Come in my office on Monday. Hang the phone up. Have no compassion one way or the other how that person was going to deal with that diagnosis. One of the things we have in New Jersey, which is part of the Manton bill that Kathy was just talking about, is the New Jersey Seed Program. Again, it takes care of breast, cervical. They pay for screening and for treatment, but for prostate, we screen them, but we have no treatment options. So what are you going to do? Take a man telling me he has prostate cancer and say, well, it was nice knowing you, you might as well just call it a day. So it's really been very difficult. And but one of the things I've learned since then is that we really need, as a group of women, because I've been told this for the time I've been doing this, is that women make a difference. And you know, the men will say, well, what about Breast Cancer Coalition? They always get what they're looking for. Well, the men don't want to step up to the plate. Some people think they can't make a difference. And so that's one of the reasons why the Women Against Prostate Cancer became an important issue for me, because I felt like, here was my husband as a congressman, I've got this incredible center, but we really aren't doing what we need to do to hear the voices for our men. So I assumed at this point it was time for us to step up to the plate. Just like when I was at a church one day and they were having a screening, and this one gentleman comes up and he goes, think I'm afraid to go have the DRE done. And I looked at him, I said, look, my husband died of this disease, and I'm here to make sure you don't, so get in there. Well, he went in, reluctantly, but he went. But basically, we have some other programs within that. We've done we've partnered with churches. We have a screening in September, and this year we screened 500 men over a 3-night period and on a Saturday. We partnered with the churches, which helped a lot to bring the men into the, to the screenings, and we also fed them food, which was really good. So anyway, we do a lot of things, and I don't want to say too much more because I know we're waiting to move into our next part of the program. But I just wanted to explain that we are actually one of 2 centers in the nation that are actually funded by the Congress, prostate centers. It's our center, and I think it's the one, CPDR is the other one. So there's only a disease, Walter Reed. Is that David McLeod's program, correct? So we're very unique in that respect. So if anybody needs somebody to come to New Jersey for help, we are here, we take care of everybody. And in 1996, we did have a bill passed that the insurance company with employees over 550 people had to pay for the DRE and the PSA, starting with 40 with the family history and with 50 for the general population.